If your dog's scooting, licking its bum a lot, maybe not quite itself, or there's a strange fishy smell around, then it may be one of the most common issues we see as vets, anal glands. My name's Jim and I've been a vet for 20 years and I've founded 4 vet practices, and we're actually in one now. And during that time, I've helped literally thousands of dogs with their anal glands. Now, they can be really uncomfortable to watch as a dog owner with your dog suffering from them, but a few simple things can really help your dog's discomfort. So let's go through it. Let's start by talking about where anal glands are and what they're for. So the anal glands are 2 small scent glands that are located just inside your dog's anus, your dog's bum. They're at about 4 o'clock and about 8 o'clock, if you imagine it like a clock face. And they're about the size of a small grape and sit just under the skin. Now, these glands produce a very, very distinctive smell, that fishy sort of smell we talked about earlier, which forms part of your dog's natural communication system. Now, normally, every time your dog passes a firm stool, the idea is that the stool passing past the anal glands causes them to empty, a bit like squeezing a tube of toothpaste. And that then coats the stool and leaves it as a communication post for other dogs. Now, in healthy dogs, the idea, as we mentioned earlier, is that anal glands empty on their own. But when they don't, for one reason or another, then the fluid can build up, thicken, and even become infected later down the line. Now, we see full anal glands, or blocked anal glands, fairly commonly in practice. And very often we see it in small breeds, cockapoos, Frenchies, or Chihuahuas seem especially prone. And when the fluid builds up and it doesn't come out, that gets called an impaction, and it's uncomfortable, but quite manageable. The next level of problem we see after that is when that area is a dirty area. It's when bacteria manage to get down the duct into the anal gland and set up an infection. And that leads to redness, swelling, and a really, really uncomfortable dog at that point, and ultimately ends as an abscess. And the good news is most of these cases can be sorted pretty quickly once we know what we're looking for. If you'd like a bit more help with this, including what to feed, what to watch for, and how to stop these issues coming back, I've put together a short email series called No More Scooting, A Vet's Guide to Happy Bottoms. Now, it's completely free and packed with practical tips that we use here in the practice. You can sign up using the link below. The number one sign people report and people notice is that classic scooting, that bum drag along the carpet. Now, often people associate that bum drag with worms. It's not. It's more than likely going to be anal gland issues. Sometimes the owners will also say that, or in isolation, that the dog has been licking or chewing their bum more than usual. And another, probably the big giveaway, is that sudden fishy smell. It's really, really distinctive. It's really strong and unpleasant, and it's really hard to miss. And as that pressure builds up in the anal gland, dogs will often strain to pass a stool and look uncomfortable when sitting. And some dogs just seem off. They seem a bit restless, a bit jumpy, and a bit grumpy. Now, I think it's really important that you know your dog best. So if something's changed, particularly around toileting or behaviour, then it's probably worth checking out. And it really is a quick check with your vet. What can we do to treat it and manage it? Now, in simple cases, your vet or your vet nurse, they can express the glands manually. And it's really not a glamorous job, but it is quick and it usually gives them instant relief. Now, we used to have a few problems with my first Labrador, Molly, and it got to the point where if I ever put a pair of latex gloves on in the house, she would run and hide because she assumed I was going to squeeze her bum. So they don't like it either, but it does provide that quick instant relief. When we squeeze them, we'll be looking at the characteristics and the qualities of the discharge. That sounds horrible, but that's how we're going to pick up if there's any signs of infections. And once we've cleaned them out completely, if we are concerned, then we may consider prescribing a course of antibiotics and probably some anti-inflammatories to go with that as well. This is a very delicate area, so unless you're happy and confident have been shown by someone who knows how to do it, then you probably shouldn't try this at home. We have seen a few dogs over the years who have trauma from well-meaning attempts at home. If your dog's stool is soft and maybe they're inconsistent or they're loose, the glands may not be getting enough pressure and stimulation to empty properly. So one of the simple things to do is add more fibre to the diet. So that could be adding more natural fibre, so carrots or some vegetables to their diet, or it could be using a supplement, a pro-fibre supplement. These help bulk out the stool naturally. I really also recommend it's worth looking at general digestive support, so pre, pro and postbiotics, really to condition that gut microbiome to make sure we are getting good digestion. But really, if they're having issues more regularly than once a month, then I think we really need to make some sort of decision about further investigations. So food sensitivities or environmental allergies like pollen, dust mites and grasses can lead to chronic inflammation of the glands and their surrounding tissues. We often see dogs where the real issue isn't the glands themselves, it's an allergic inflammation. So if we suspect this, there's a few things we can do. So we might consider an elimination diet or switching to a hypoallergenic diet to reduce any dietary intolerance or sort of rule that out. We can consider using blood tests to screen for common environmental allergens. Whilst they're difficult to manage, there may be things we can do in the environment to help reduce the challenge from those. Or we consider using some sort of anti-inflammatory or antihistamine as a trial dose to see if we control any allergic reactions, whether ultimately our issues with our anal glands get better. If you'd like more help with this, including what to feed, what to watch for, and how to stop these issues coming back, then I've put together a short email series called No More Scooting, A Vet's Guide to Happy Bottoms. It's completely free and packed with practical tips we use here in the practice. You can sign up using the link below.